Welcome, I'm Tatiana Spiegler. I'm a patient engagement liaison representing GSA. I'm a master's prepared registered nurse with 10 years of experience. And as a nurse, I know how important education is, especially education that could help empower patients. Today, we're going to talk about an important aspect of managing your life with lupus, shared decision-making. And just as a reminder, this presentation does not take the place of talking with a doctor. When you're living life with a chronic condition like lupus, you face a lot of decisions over the course of your treatment. You and your healthcare team need to have ongoing discussions about your medications, treatment plans, and more. And that can be pretty overwhelming, right? And that's why we're here to learn more about simple skills that can help you make the best decisions for your health in partnership with your doctor and other members of your healthcare team. These proactive skills are designed to help you feel more engaged and empowered when making important decisions about your treatment. As a person living with lupus, your voice is your power. The approach to your care should be centered around you, and it's ultimately your decision when it comes to the day-to-day choices that affect your health. And whether you're newly diagnosed or you've been living with lupus for some years, or maybe you're somewhere in between, I want each of you to have tools that you need to navigate your care and get the most out of your treatment. These skills could help you work more efficiently with your doctor and feel more in control. Shared decision-making is a patient-centered approach to care that is collaborative, where you and your healthcare provider actively work together to make choices about tests, medications, procedures, and care plans. Collaborative also means that you consider these decisions with your doctor in light of your values and in light of associated risks. It is also cooperative, which means that you and your doctor and sometimes additional healthcare professionals each do your part to carry the decisions that you've agreed on. And the last one is that it is communicative, which means that you and your healthcare provider have an ongoing conversation that is open, and it's a two-way communication. The relationship between you and your healthcare provider is critically important to helping you live your best life. And traditionally, the doctor was the absolute expert who simply told patients what to do. Shared decision-making, on the other hand, is about the shared experience of you and your healthcare provider seeing both people as partners who make healthcare decisions together. You should always feel empowered to ask questions and share your perspective. These are the key players of shared decision-making. You, the person living with a chronic illness, at the center of the process. You're the authority on how you want to live your life with this. You bring experience, your preferences, and your values to the table. And around you are the healthcare providers and your loved ones. The role of the doctors and other healthcare professionals is to bring clinical evidence and experience to the table. It's their job to help you consider treatment benefits and risks, and to take your values into account when evaluating treatment options. On the other side, we have the people in your support system. They are another very important piece of the puzzle when it comes to shared decision-making. Your loved ones can offer perspective and support. And as you all can see, everyone has a defined role and brings something of value to the discussion. Simply put, shared decision-making is an ongoing conversation with one goal: making the best choices for your health. So why does shared decision-making matter? Treatment plans for chronic illnesses can be very complex. People with lupus often have treatment plans that involve multiple medications, therapies, monitoring symptoms, and lifestyle changes. And there are many things to consider, and that means that you need and deserve support. There is usually no single right answer in a health-related decision. There can be many options to choose from, and sometimes there is no right answer because the different choices present different pros and cons. Lupus affects each person differently, and the right treatment plan will vary from person to person. And the more you're actively involved and engaged in assessing your treatment options, the more likely you are to follow through with your treatment plan. This is where knowing your treatment goals and what matters the most to you comes in. Your voice and your values are vitally important. Shared decision-making helps your doctors and other members of your team find the best options that meet your individual values, needs, and specific situation. It's both your right and your responsibility to make sure that your voice is heard and your questions are answered. Letting your healthcare providers know what's important to you will enable them to evaluate risk and help you make decisions about tests, medications, and treatments, and so on. Proactive patients often get more out of their care. Studies have shown that the more a patient is engaged and active in healthcare decisions and discussions, the better their health outcomes and experiences. And now we're going to talk about shared decision-making in action. How do you put all of this into practice the next time that you're faced with a decision about health or about your health? I'm going to repeat that one more time, sorry. Now we're going to talk about shared decision-making in action. How do you put it all into practice the next time that you're faced with a decision about your health? There are 4 main elements or skills when it comes to your role in shared decision-making. The first one and the most important principle is for you to be proactive and stay engaged in your treatment journey. You need to understand your lupus and feel confident sharing about it with your healthcare providers. You need a willingness to manage your own health and be your own advocate. This also means making the commitment to yourself to increase your knowledge about your disease. And that is understanding how it starts, how it's diagnosed, how it may change over time, and how it may impact your life. And of course, don't hesitate to ask questions. Remember, shared decision-making means that you and the healthcare professionals on your team are equal partners in your care. The second element of your role in shared decision-making is to think about your situation and understand how your personal values influence your health choices. What are your main goals for treatment? How has lupus impacted your life? Or maybe what matters the most to you? You're an individual with unique circumstances and preferences, so it's important to get clear within your own mind and heart and then communicate clearly about what matters the most to you when it comes to managing your illness. The third element of your role involves knowing your health history and telling your ongoing health story to your healthcare team. Your health history includes documents on your diagnosis, lab tests, procedures, symptoms, etc. And your ongoing health story includes your health journal or another method for recording symptoms, triggers, side effects, or any other health indicators that you're tracking, like weight or maybe your blood pressure. And finally, when you have a medical appointment, be sure that you're prepared and that you're prioritizing your questions ahead of time. At the appointment, structure your concerns and present them concisely. Listen actively, ask questions, and clarify what you've heard. Be sure to bring your health journal and your symptom tracker. And you can also use the PART method for communicating with your healthcare team. It's P-A-R-T, prepare, ask questions, repeat, and take action. Prepare for your visit ahead of time. Track your symptoms and your triggers, record how lupus is affecting your life, and make a list of all the questions. And I'm gonna add one more thing, and that is to number your questions in order of importance, starting with number 1 as the most important. Ask your questions during your visit that you brought with you, along with any others that may come up during your visit. And before you leave, make sure that you understand any new diagnosis, tests, treatments, or any other instructions. Repeat. To help you with your understanding, replay the key points of your visit back to your doctor to be sure that you've heard them correctly. And the last step is to take action. It's very likely that your doctor has instructions and other steps for you. Make sure that you're clear about them and then follow through. And I want you to feel empowered to advocate for yourself when you're facing important decisions about your health. This approach can help you feel more informed and in control. The first step is to think closely about the decision at hand. Why are you considering the options? How will they affect your life? Or maybe how soon you need to make this decision. This is a good time to reaffirm your values and your goals so that you have clarity going into the decision-making process. I'm gonna repeat that, I'm sorry. And the first step is to think closely about the decision at hand. Why are you considering their options? How will they affect your life? And how soon will you need to make the decision? This is a good time to reaffirm your values and goals so that you have clarity going into the decision-making process. Do you know enough about the options that you're considering to make an informed decision? It's always a good idea to ask your healthcare team for information and resources, and to ask specific questions about risk, side effects, and potential benefits. You need to know how a treatment may affect you, and also need to discuss what success with a treatment could look like. Having a realistic expectation is key when trying a new medication or therapy. Important health decisions should always be made in partnership with your doctor and any other healthcare professional on your team. Remember, this isn't a one-way relationship. Work together to evaluate each option, the potential benefits and risks, and considering individual values and needs and preferences. This process is an ongoing two-way conversation. The more you share with your healthcare team at each visit, the better they will be able to help you evaluate the results. And the last step is to involve their support system throughout the process. Your loved ones can be an invaluable source of support and comfort as you navigate life with lupus. And involving your support system may mean taking a family member to your doctor's appointment to help you take notes and be an extra set of eyes and ears. Or maybe asking your spouse for their perspective and input on a potential treatment. Communicating with your loved ones about how decisions may impact your life. And talking to others with lupus as part of a support group. Remember, shared decision-making is a process. And to learn more, you can visit the GSK Patient Learning and Community Education Hub, or GSK Place Hub. There you can find a diverse mix of resources designed to help you through your treatment journey, and they're all free. So please scan the QR code and check out the resources. And if you're on your phone and you can't scan the QR code, you can check us out at www.gskplacehub.com. And finally, thank you all for joining me today. I'm so glad that we got to talk about this very important topic, and I hope that you've learned a few helpful things that could make managing your life with lupus a little bit easier.